it's still not.
Okay, no problem. If you are having
Can
some...
you see? You can't see me, right?
No, yes, yeah, I can
It's
see you.
black, right?
Yes.
I don't know because the video is on. So I have all the presentations and I have the questions ready.
Okay,
And I've
so
spoken to Preeti.
okay, so Dr. Maninder, we are on live, so we can start the session
Okay.
now. So yes,
Okay.
so I'll be starting the session. Welcome everyone. This is Faisal Shabir. I'm Senior SRHR Advisor in IPPF SARO office. And today we are having session named Alternative Voices in SRHR. And our session moderator is Dr. Maninder Singh Sethia. Dr. Maninder Singh Sethia is a consultant dermatologist from Mumbai, India. He has completed his MD in dermatology, laboratory and sexual transmitted infection from the University of Mumbai, India. After completing his MD, he did his master's in public health from University of California, Berkeley, and PhD from McGill University. He is also involved in clinical care of HIV and STIs apart from dermatology, with a particular emphasis on men who have sex with men and men to female transgender people. He is also involved in clinical public health and epidemiological and operational research in HIV, STIs, sexual health, and various other clinical areas. He also enjoys to mentor students in their academic research. So we are pleased Dr. Maninder is moderating this session. So I would like to hand over this session to Dr. Maninder. Dr. Maninder, over to you.
Thank you, Faisal. So I hope I'm audible. In this session, this is a very interesting session. We have speakers from 3 different countries, and the session will focus on the various voices and experiences from SRHR champions who have worked in the community and have used newer techniques, and they will share their work from the grassroots. These people are well recognized in the community in the South Asian region countries. The session will also provide an opportunity to learn about different working models, best practices, challenges, and strategies. So we have 3 speakers for today's session. As a general rule, I would request the audience to just write their questions, and the questions will be shared with me, and I will put forth the questions to the speakers. The way the session will work is we will first have, I will first introduce all the 3 speakers, or I'll introduce all the 3 speakers. Then we will have the talk by each speaker. The speaker will be discussing the project and sharing his or her work experience. During this time, if you have any questions, please note down the questions and feel free to ask your questions and just type them. And we have a moderator who will be, we have logistics people and other people, and moderator and coordinators will be sharing the questions. After the speakers have finished their discussions, I will initiate the question and answer session. There would be 2 to 3 questions for each speaker, and then we will open the forum to the audience questions. Okay, so I hope we are able to finish this by 4:45 or 10 to 5, because we have to move on to the next session as well. So I would request the speakers to stick to time. So we have 3 speakers today. The first one is Rajendra Maharjan. He's the country coordinator right here, right now, and he's from Nepal. Okay, Rajendra Maharjan is a development professional with a decade of experience in partnership building and management, capacity building, project management, organizational development, and advocacy. He currently leads the Right Here, Right Now project in Nepal as the country coordinator and oversees all aspects of management and operations, including planning, implementation, and day-to-day management. He has expertise. His expertise includes managing developmental projects with a special focus on increasing accessibility and accountability for services, addressing special needs and issues of target groups, and promoting evidence-based best practices. His expertise lies in his ability to lead networks, document evidence-based best practices, and disseminate the practices through training and interactions. So he'll be our first speaker. The second speaker is Natalie Soysa from Sri Lanka. She's an activist and co-founder Bender. Is a digital feminism activism group in Sri Lanka formed in March 2019. Bender uses graphic design as conversation starters, sparking of essential conversations around gender and sexuality. Natalie's core body of work is as a lens-based artist, but they also work on as an editor, journalist, writer, graphic designer, and occasional filmmaker. After a successful, as she says, boring 12-year career in marketing communications, Natalie retired early. She would like to qualify that to focus the energy on things that matter most. In the past 11 years, Natalie has produced work that confronts what we would rather ignore, our complex relationship with ourselves and one another in the context of gender, race, religion in the post-colonial and post-war Sri Lanka. She's the second speaker. The third speaker is Arthi Shukla. She's from India. She's the creative director, Love Matters India. She is a BBC trained editor with expertise in storytelling for social change. Arthi is the creative director at Love Matters India and founder at Teen Book. She develops and implements creative vision and drives the content strategy at Love Matters India and Teen Book. She loves to read, travel, and write. So we have a range of experiences and great expertise from these three different countries. And I would encourage the participants to enjoy their session, their talk, and ask as many questions. And we will try to accommodate as many questions as we can in the question and answer session. So over to you, Rajendra Maharajan, the first session, Young People's Initiative in Nepal. Rajendra? Rajendra?
Dr. Maninder, I think Rajendra has some issue. So
okay,
we can
so
move
can
to
we start with Natalie?
Yeah.
So Natalie, can you start? Natalie? Hello.
Hi, Natalie. So you need to unmute yourself.
Okay, so Natalie is suggesting that she wants to present. Can we have Arthi?
Hi, Dr. Maninder. Yes,
Yeah,
sure.
can you? Because there was some problem with Rajendra, so we had to switch the thing. Is that okay?
Yes, that's fine. I can go first.
Sure. Thank you.
All right. Thank you, Dr. Maninder. And hello, everyone. I'm Arthi Shukla from Love Matters India. And today I'm here to talk about our work in the field of sexual and reproductive health and rights. And I'll take you through the journey that we've had at Love Matters India. Please allow me a minute to just share my screen so that I can have my presentation up for you to view. Can you all confirm if you can see my presentation?
Yes, we can.
You can. So thank you very much. Before I begin and talk about what we do at Love Matters and our journey, just had a couple of thoughts on the topic of the session today, alternative voices in SRHR. And it got me thinking, what are alternative voices and how are they different from mainstream voices? So that's something that maybe is something we can discuss later as to what constitutes mainstream and what constitute alternative. I guess alternative comes from being different from traditional approaches to sexual and reproductive health and rights and family planning, which have been practiced for decades. And there are some new approaches that organizations like mine have tried, and which is what makes us alternative. What are these approaches, and how have they worked for us? That's what I'm going to talk about today. Before we get started, I wanted to introduce Love Matters to everybody. So Love Matters is a global program, and we are present in 7 countries and regions. That includes India with English and Hindi, China with Chinese, Love Matters Arabic, that covers the Arabic world, Love Matters Africa, which covers the Sub-Saharan Africa with English and Swahili, and Love Matters Spanish, that covers Latin America. Love Matters is an online and offline project to basically provide open, honest, non-judgmental, pleasure positive, free, multilingual, and youth-centric sexual and reproductive health and right information to young people across the world. It was a project that was launched in 2011 from India, and then it spread to other countries of the world. And India is its biggest and longest running project, with over 20 million users every year on our websites, and with over 1.5 million users connected to us via social media. So what do we do at Love Matters? We basically, like I said, provide information on love, sex, and relationships to young people in all of these 7 regions of the world. And how do we do that? We do that by putting information on our website. So for example, the India website is lovematters.in, which is a bilingual website in Hindi and English, providing all the information that young people need with regard to their love, sex, and relationships. We also run a chat board on the website where young people can come and ask their specific queries, to which Love Matters experts provide answers to. So it's also a one-on-one sort of query platform that we run on our website. Other than our website, which is in Hindi and English, we also are present on all popular social media platforms, which is Facebook, Instagram, Twitter. We were also on TikTok before it was banned in India. And we also now are on a new app called Clubhouse, where we hold conversations with people around love, sex, and relationships. On our social media platform, we are providing same information, but in the tongue-in-cheeky way that social media content works in. So we add fun to what we do on a daily basis on our social media. Before I get into what makes us alternative, what makes us work, what are our USPs, just a quick check on the values, because sometimes it may be that the alternate kind of sort of maybe differs from values on how sexual and reproductive health and rights are given. And that's something that we wanted to make clear, that even though we are an alternative voice, even though we are trying innovative ways, our values remain firmly rooted in the sexual and reproductive health and rights that have been universally agreed. So in that, we strive to give best knowledge to young people. We are honest, we are integrative, and we are inclusive. So our content is not made not made for any particular section or community, even though the content that we work with can be really taboo in the countries that we operate in. We still make sure that we are committed to the inclusivity and values that sexual and reproductive health and rights have universally been accepted for. So it is a tough and challenging balancing act at times to make sure you're inclusive and yet not offending. But at the same time, we do maintain these values in our work, and which is why it becomes a little more challenging, and I'll talk about those challenges later in my presentation. Right. So what makes us alternative? What makes us different? And why are we here today? So Love Matters India, or for that matter, any Love Matters projects around the world began with what we call the pleasure approach to sexuality education. So as you all are pretty much aware that the sexuality education or comprehensive sexuality education began to take steam in the late 90s, especially with HIV/AIDS sort of gaining sort of momentum around the world. So the approach to sexuality education was pretty much disease-based, where you would be like, you need to practice safe sex to avoid getting sexually transmitted infections, diseases, prevent pregnancy. While therefore it is a useful approach, and it still remains useful, and it is at the heart of what we also do at Love Matters India. There tends to be a tendency amongst young people to not engage with risk-based and fear-based informations. And this has been conclusively proven in many studies that Love Matters conducted itself, plus many studies around the world that we base our work on. So a decade ago, Love Matters started this project where we sort of give out comprehensive sexuality education, but by acknowledging that sex, love, and relationship is a happy part of young people's lives. It's something they look forward to. It's a part of being young. And so any information that is given out for this purpose needs to be engaging. It should not be fear-based. It should acknowledge that young people are actively looking for information on sexual health. It's just that it needs to be given in a format that doesn't scare them away. It should acknowledge that sex is a integral part of young people's, or for that part, integral human experience, and acknowledge and respect that, and then give out information to make sure that the health risks are reduced, there are no diseases, there is safe sex, there is no unwanted pregnancies, but within the ambit of accepting sex as something which is not taboo, nothing to be shy of, ashamed of, and for people to accept sex as a healthy and happy part of their lives. So when we talk about alternative, this is where we began as an alternative approach. And if you would look at content across Love Matters India platforms, the things that sets us apart is how we approach in our content. So the couple of principles that we work with are that all our content has to not judge people for their sexual choices. Secondly, it should not propagate fear around sex. Any communication that we do needs to accept sex as a daily, normal, healthy, happy part of people's life. And the last but not the least, we encourage conversations on sex and sexuality, which also meant that we just simply couldn't just talk about sex as a physical act, sex as a body related thing, or sex as a thing that leads to pregnancy or diseases. We have to talk about sex as a human experience that sits in the middle of love, relationship, pleasure, human needs, an activity that you do when you get bored. There's so many aspects to sex, and at Love Matters we embrace them all and talk about not just sex, but love, sex, relationships, human needs, and pleasure. So when we so that's an approach that Love Matters began with a decade ago, and year after year we have seen young people engage with us, young people talk to us, and young people sharing with us what they have said that they could never share with anybody else, just because they don't feel judged, they don't feel shy, they don't feel ashamed, and they willingly want to get information on these topics and subjects. The second thing that sets us apart or is an alternative is that we try to make sex education or any communication that we do not boring. So that's a complaint that young people always have, that sex education, or for that matter any education related to our body, can get very boring, especially in our school curriculums, and young people tend to then disconnect with it. So one of the approach that Love Matters has taken is that while we are pleasure positive, we are also going to have a lot of fun. We are going to be fun. So whatever content we create is steeped and based in popular culture. It's based in what young people like to do, and it's kind of easy on the eyes. It's something you would want to click and read. So as you can see, some of our content, which is in English and Hindi, we kind of use popular culture, cartoons, memes, videos, Bollywood, but at the same time, we talk about safe sex relationship, healthy relationships. So you see Budhiapa, which is our Wednesday puzzle. It's a very popular Wednesday activity on our social media, and people very happily engage, take part, and demonstrate really good knowledge of sexual and reproductive health and rights. The second at the middle of your screen is our Veer Ka Teer, which is a comic, satirical, witty comment around issues that we talk about. And if you are from the South Asia region, you know the popular truck art that can be very funny and witty and is used across our region to really propagate a lot of fun messages. And here we have used the same truck art to talk about condoms. And on the right, you see what is our Tuesday feature. We call it Mangal Gyan, which is the Tuesday knowledge. And here we talk about how menstruation works. And I'd like to share that when our designer, the creative designer, when she was designing this poster, she said, you know what? To be very honest, it's for the first time I have understood how menstruation works, even though I've been having periods for good 20 years now. So that's the idea, that young people really just don't know about menstruation and safe sex. They really understand what's going inside their bodies. And to be able to understand that, we break down those boring biology lessons into fun, engaging, comic, creatives that people can really digest. So the second thing that sort of makes us alternative or sets us apart is the fact that we break down really complex information into easy to digest content. And you know why this is important? Often we tell people you need to use condom to have safe sex, you need to prevent pregnancy, you need to do this, you need to do that, lots of instructions, without young people really understanding what is happening inside their bodies. Until the time you don't really have a clear picture of what's happening inside your bodies, you're going to be very dependent on other people taking decisions for your bodies. You need to know how pregnancy happens, you need to know why menstruation happens, you need to be able to so thoroughly be aware of your body that when you take a decision, you know what impact it is going to have on your body. And so far, the body knowledge is so scientific that young people often do not engage with it, and which means they run the risk of making decisions about their bodies without really having the full picture. So that's something we are trying to break at Love Matters, is to make content so much fun that you would not shy away from it. The third thing that sets us apart is that we're not just talking, we're not talking the talk, we're also walking it. We are connecting ground services, access to services with all the information that we are providing. So while we give knowledge to people, we're also connecting them to good services and doctors who can provide them with these sexual and reproductive health and services. And it's just not name references that, okay, this is the clinic you can go to. We're also working with these clinics and doctors to make sure that the non-judgmental kind of information we share with people is the same non-judgmental approach with which these clinics will provide services to our audience. So we work and we do trainings with all the service providers, all the clinics, all the health professionals to help them understand the non-judgmental attitudes towards sexual and reproductive health services, which is a huge problem in the South Asia region, that there's a lot of judgment around sexual and reproductive health. And while we can do all the talking online, if offline, when people go and access services like abortion, like pregnancy, like trying to get a contraception fitted, and they face a lot of judgment on the ground, then our work is half done. So at Love Matters, we are working with offline services, trying to make that experience also non-judgmental, so that everything sort of comes together in full circle when young people try and access these services. Fourth thing that's kind of sets us apart or alternative is that we are trying to talk to people much before they probably get sexually active, much before they need to use a contraception, much before they have experiences which they might not enjoy or regret, which is often an experience in our region, that you have your first sexual experience without knowing about contraception. You have your first period without knowing about menstruation. And that's what we are trying to change. So at Love Matters, we have launched our adolescent initiative called Teen Book India, which is basically giving comprehensive sexuality education to teenagers, which is age appropriate, which we talk about stuff that is age relevant. And we start with teenagers as young as 13, and we tell them about their body. We tell them about the feelings that they're having. We're telling them about the experiences that they are going through, and we are taking it beyond menstruation, which is something that's been a lot of conversation around, but not any other sexual development that their bodies are going through. So we have launched a new website called teenbook.in, and again, on all social media platforms, we're talking to teenagers so that when teenagers enter adulthood, they know about their bodies, they have all the information they need to have happy, healthy sexual lives. Whenever they start upon it, they start with the point of information and not ignorance. And on this, we are working with leading organizations and brands in the country to create contents. So for example, what you see on your screen right now is a curriculum. It's a year-long curriculums for 2 grades, grade 8 and grade 10, that we have prepared in collaboration with Durex India to teach and talk about comprehensive sexuality education to 8th graders and 10th graders. And this curriculum has been rolled out in the 7 states of Northeast India. And it's very, very comprehensive, from talking about to safe sex, to peer pressure, to substance abuse, to how to stay safe online. It's a really what you call a 360-degree approach to adolescent development. So again, the fourth thing that we are talking about is to talk to young people young and early, to avoid them having any unpleasant experiences, which can often be the case when you enter adulthood without having sufficient information. We're not just online, we're just not on social media or websites. We're talking to young people offline. We do a lot of workshops, and we take what the resources from our websites to young people across the country, especially in the states of Bihar, Uttar Pradesh, Rajasthan, Madhya Pradesh, where we have very regular workshops with young people. And here we are trying to engage more and more with girls, because often, and in our own research, we have found that there's a huge gender gap when it comes to knowledge about sexual and reproductive. A very recent survey that we did in Bihar amongst 200 young people, the difference between the girls and boys knowing about information is as much as 80% boys knowing about stuff and only 20% girls knowing about the same issues and topics. So we're trying to work a lot with girls on the ground. Last but not the least, this year we've tried something new, and where we're not just talking about sexual and reproductive health. We are training young people on actual 21st century skills that they can apply, they can use for their careers, they can sort of employ them to get jobs, and basically to become confident young people who know how to talk about complex issues. So some of the skills that we have within the organization, like journalism, digital content, interviewing, video production, social media production, we ran a 4-month-long training program called Mobikar, Naye Zamane Ke Patrakar, which translates to mobile journalists, the new age journalists. And in this, we trained young people from over 150 young people from Bihar and Jharkhand state of India on their sexual and reproductive health and rights. We trained them on public interest journalism, and we trained them on how to make video content. So at the end of this program, all our Mobikar graduates produced strong films on issues ranging to um, uh, uh, teenage pregnancy, teenage marriages, dowry, domestic violence, substance abuse, and some really hard-hitting, powerful documentaries coming from the ground. So not only did we share knowledge and information with young people, we gave them skills that they are now employing in their day-to-day lives. And like we said, the way we have online fun, we are also having offline fun. We regularly, and this obviously pre-COVID, but we are organizing fairs, festivals, so that what we do with people online in terms of having fun and giving out information, we also do the same offline. So this what you see on your screen was our abortion campaign. It was a very heavy topic, but we made sure that we organize it in a way that people engage with concepts like abortion, which is very hard to get. It's very hard to get young people to engage with issues like abortion when it really impacts their lives. There's so many unsafe abortions, but it's very hard to get young people to engage with that. So again, we organized a festival, which we call Jashne Reproductive Rights, to talk about abortion. Like I said again, we are online, we are digital, which kind of sort of sets us as alternative, not mainstream. And here we are continuously innovating so that, okay, what is the latest new thing? In 2011, it was the website that we launched. Then we went on social media. Sorry. Then we produce virtual reality films. And our latest offering is an augmented reality app to provide comprehensive sexuality education to young people. So we know today's young generation likes to get stuff on their mobiles via apps. So we launched this augmented reality app, which works with grade 8 science curriculum. You scan through your science book and you enter the app, and you kind of get all the information that you need on your body, on your health, on the sexual development of your body, and so on and so forth. Not just it gives just information, it's also fun, and it kind of is right up young people's street who like to get their information via digital and via innovative platforms. We also tested this app with 200 school students in 5 different schools around in 5 different states around Delhi, Delhi and the National Capital Region. And we have actually tested and improved upon this app after working with adolescents. So it's a lot of testing and developing and improving that we are doing at Love Matters, so that we remain innovative, we remain cutting edge, and we keep trying things that we know that, because young people will move on to the next thing. It's very easy to lose relevance. It's very easy to become boring. It's very easy to not be the in thing. So with digital format, it's very important to remain innovative and cutting edge. Just to wrap up, we are being bilingual in Hindi and English. We cover about 20 million users every year via our website. And here are the top regions that we operate in. We cover a huge part of the country, and resource and funds permitting, we would love to launch Love Matters in more languages to cover the rest of the country as well. Just to summarize, what sets Love Matters apart? We understand young people, we understand their love for technology and digital, and we'll understand that young people want their information in non-judgmental, open, honest manner. And that's exactly what we do at Love Matters. And now we are also doing the same for adolescents under 18, so that when they enter adulthood, they are ready with the information they need. And format is not a bar for us. We use video, story, comic, audio, podcast, surveys, workshops, curriculums. So we've been really experimenting with a lot of formats to be able to give this information out to young people. I am very conscious of the time and I may be overrunning my time. So I would like to wrap up here just by saying that what keeps us relevant and sort of mainstreaming our alternative voice is the fact that this is the digital age. This is the age where technology plays a key role in the communications that we need to have with young people. And we are at the heart of it by using media, by using digital platforms, and by using cutting edge scientific information to stay relevant and to use innovation in everything we do. Thank you.
Thank you, Arthi, for that wonderful presentation and excellent work. We'll come to the questions later in the session, and I hope we have enough time for for the audience as well. So is Rajendra here now? Is he ready? Rajendra, can you start?
Yes, I'm here and I'm
Okay,
ready.
Rajendra. So we'll have the next presentation by Rajendra, and he's from Nepal, and he will talk on young people's initiative in Nepal. Okay, over to you, Rajendra.
Thank you. Thank you very much, Milena. So while be sharing about our experience working in Nepal, I'm Rajendra. So I'm the national coordinator for Right Here, Right Now Nepal, and we are working on youth SRHR and young people, focusing on comprehensive sexuality education. So before I discuss about youth SRHR and our work, I would like to share some of the quotes we found during our baseline survey, and it was done we recently did a survey in this July, and one of the girls said that even in this 21st century, the young girls, if they are sexually active, then the society will link with her character, her parents' character, and it is labeled as immoral for the society. And it is not limited to the society, but it is expand to the health professional. Even the female doctors will label uh, their characters as a bad, and they try to misbehave. So that context is still there here in Nepal. So we found that one of the young men in province, Harvest province, shared that even if girls wear a skirt, then she will be called as uncivilized or uncultured. So even wearing a skirt is a problem in society. And one trans man shared that when that person went to the doctor, then the doctor asked different questions, and it was quite discriminatory, and it was quite difficult for that person to answer. So this, if you look at the situations for the young people in Nepal, then it is very difficult, it is very challenging, and it is kind of linked with fear, stigma, discriminations, and it is very challenge for young people to go through SRHR problem and have services for SRHR. So in Nepal, we have more than 40% of total population is young people. The, and the young people are from diverse community, that they live in diverse political, social, culture, and economic context. So this barrier often, so this barrier of talking about sexuality education, or when sex being taboo, then that leads to different consequences like HIV and AIDS, unsafe abortion, unintended pregnancies, and different challenges. So we found that if there is comprehensive sexuality educations available for young people, then it can lead to solve all these uh, challenges, or they can they can cope up on these challenges, and uh, they they uh, they can find the way for the empowerment for themselves and other young people. So in that, hmm, the looking at again what is the sex and sexuality in Nepal, then it is perceived as same. It is perceived as stigma. There is a stigma, discrimination is there, family prestige is there, and there are fear factors where that that leads to limited educations, limited information, and limited SRHR communications. Uh, Not only for the young people, for the other health providers also, and that is leading to the unsafe sex, on unplanned pregnancies, and unsafe abortions in Nepal. So during the COVID, first and second wave in Nepal, we there was lots of cases of suicides by young people because of different cases, and that includes not having proper information on sexuality education and SRHR. So in that context, we thought that we should work on in this young people SRHR, and we should be working on comprehensive sexuality education. So we formed right now a coalition. In that coalition, we come up with different organizations working on young people and SRHR to discuss, to fight, and to challenge the young people SRHR. And we aim to empower young people so that they can exercise their SRHR. So we are thinking that young people, we are aiming and we are working for young people. We are working to empower young people uh, from different diversity so that they can exercise their sexual and reproductive health and rights in supportive social and enabling legal environment. So we are trying to create an enabling environment uh, that is social and also the legal supportive environment where young people are empowered, not only empowered, but they are exercising their sexual and reproductive health and rights. So in Nepal, in 2018, the government has passed an act on sexual and reproductive health and rights. So Nepal has, for the first time, Nepal introduced SRH as rights for all women and girls and young people. So that has ensured, and that has mentioned, that act has mentioned that sexual and reproductive health is rights for everyone. And we are trying to work with government to implement that act. So we are working on four different pathways. One is youth empowerment. So in this pathway, we empower young people, we generate youth leaders, uh, and then we deliver CSC sessions in the community. We capacitate these young leaders. We provide technical and capacity building opportunity for these young people, and we bring diverse young people that includes young people from LGBTI community, young people living with disability, and bring them together to provide them with enough knowledge and skills on SRHRs so they are empowered and they can raise their voice uh, on their own issue. And second pathway is public support. When we say public support, we believe that only empowering young people uh, doesn't bring change. So that the young, if we, even though we empower young people, that young people needs to go to school or family and when they go back to home, then they have to listen the parents, they have to listen the teachers, and going against or challenging parents and teachers is very difficult. So we, in pathway 2, we bring these parents, teachers, community leaders, influencers, even media, uh, to sensitize them, to increase their understanding on youth SRHR and its importance for young people. And we try to generate their support in advocacy, in empowerment of the young people in Nepal. And third is policy advocacy. As I mentioned earlier, we have ACT, was Right to Safe Motherhood and uh, Sexual Reproductive Health Act in Nepal. And we have regulations developed in 2020 to implement that act. But in terms of Nepal, we are quite progressive in in policy formulation, but in terms of implementation, there is always challenge, there is always delay, there is always lack of the, the enthusiasm in government to implement the act and policies. So we advocate with local, provincial and federal government to implement that act, implement the policies and programs they have ensured. Even in school sector development plan developed in 2018, they have mentioned comprehensive sexuality education for all the students, but implementation there has limited content of CSE and school curriculum. So we, as a coalition of uh, different organizations, we develop a CSE curriculum uh, based on the technical guide, ITGSC, and we hand it over to the government, and we are advocating with them to implement that CSC, and that's need to be compulsory for all schools and all level. And that's policy advocacy is going on. And last and final approach is capacity strengthening. We believe that working on SRHR is not easy. So we need, as organizations, we also need capacity strengthening. And as a coalition, we need to develop capacity of other CSOs working on CSOs, working on youth SRHR, and bring them together, form a network, work as a team to fight the issues, to fasten the process of implementation of policies Nepal government has formed. So in this way, we see that it is the holistic way of working for youth SRHR and empowering young people so that they can exercise youth SRHR in gender justice society. So we work with the individual. As I mentioned earlier, we work with young people. We provide them with knowledge and skills, and we build their capacity so that they can raise their voice, they can take actions against the issue they want to work on, and they can demand for comprehensive sexuality educations. They demand for proper knowledge and skills with schools, with parents, and with peers. And then we work with their parents, their family, and their peers through young leaders, so to involve them and then bring them together to understand what's going with this individual and how they are transforming with knowledge they have been gaining and the skills they have received from the program. And we do work with the schools, healthcare system, and workplace. And the schools being places where young people or students come together to study. And based on the Nepal government's law, there is a school curriculum called Environment and Health Population Study, where they have included sexuality, few of the content of sexuality education, So we use that school and healthcare system as a platform to bring young people and to understand their needs and to deliver uh, sexual education for them. And we also bring media and especially the religious leader where to sensitize them and to bring their support on the work we are been working, and obviously public advocacy where we work with government and politicians and even policy makers to discuss, to sit together, to have a dialogue with young people to implement the act or policies they have formulated. And we work through our principles, and in this context we have 3 organizations working as a writer right now, and we are expanding with few more organizations, and we are guided by the same principles of meaningful and inclusive youth participation. We, from the beginning, from the decision making stage to the implementation to the shareholder, as young people, we bring diverse young people, and we ensure their participation meaningful and inclusive. And next, in inclusiveness and intersectionality, where even among the young people, we try to bring young people from different background, different geographical spaces, different caste, religions, even in the LGBTIQ community in our programs, and they lead. They are not only the beneficiary, but the shareholders. They are also the leaders to implement our programs. And next one is gender transformative approach, where we talk about power relationships, power dynamics, engaging men and boys in the process of empowerment of young girls and women uh, eh, to for the programs and the overall process of planning and implementation of process. So we do work with human rights based approach, and we try to we try our best that our programs, our staff, our volunteers uh, do not harm anyone in community and the society. So, but these are the few approaches that we worked through, like media campaigns, local, national, and international advocacies, workshop and technical supports. We do local and national media mobilization. We do regional and international advocacy. We do day celebration and capacity strengthening. And these are the few resources that we have developed. Uh, this is CSE booklets we develop and handed over to government. We have this advocacy guide. We have media monitoring reports where we monitor media, how these media are providing spaces for young people and young people SRHR. So we have shadow reports for developed during CEDA 2018. We have Vienna report, and we have also national parallel report for Beijing 2025 events. So our young people participate in regional and international spaces where they advocates for young people say SRHR. We do organize national dialogues where government, young people, and other come together to advocate. We do celebrate Pride months where we demand for rights for LGBTIQ community. We especially advocates for marriage equality for LGBTIQ. We have done mural paintings where we write positive information about SRHR and safe abortion. So, so we are proud that we have managed to change some of the national medias with progressive language and safe abortion and youth SRHR, and we are proud that some of the media has given spaces for LGBTIQ community and their needs. And thank you for listening. And this is the picture taken in Nairobi, where we handed over youth recommendation developed by our coalition to Honorable Minister Thamai Thapamagar to include our recommendation in national commitments. And in the national commitment, we are proud that a few of the recommendations we provided were included in national commitments in Nairobi in 2019. That's all from my side. Thank you.
Thanks a lot, Rajendra. So we move on to the third speaker. That was an excellent presentation of the work done in Nepal. I think it's very important work that you're doing. And the third speaker is Natalie Soysa from Sri Lanka. So Natalie, are you ready?
Yes, I am. Hello, everybody.
Yeah, over to
shall
you.
I go straight? Yeah, so I'm going to keep my camera off and focus on the presentation. I just wanted to say hi and, let you know what I look like, but I'm going off video and straight into presentation. Can everybody see my presentation?
Yes, we can.
Okay, good. So I'm going to be short and sweet because Vendor is a fairly new initiative. Vendor is technically the Vendor Trust, and our latest initiative is Vendor Magazine, and I'll take you through both things. So in March 2019, 3 like-minded people launched a digital initiative under the moniker Vendor to help people bend out of archaic and unquestioned gender norms and stereotypes and bring a plethora of opinions to the table that haven't been discussed. Vendor operated primarily and still continues to do so as a private group because we wanted to create a safe space for anyone, whether it's queer or heteronormative or feminist or ally making. We wanted everybody on the table talking to each other because that's something that doesn't happen. And with a group of about 1,000 people, we have been managing to have really great conversations. We use a lot of graphic design and written content to spark off these dialogues. Then the magazine, on the other hand, is a public initiative. It's a web team who features journalism and content that is queer-friendly, ally-making, and feminist in outlook. The problem was the Vendor. We identified the problem, as I said. Additional problems that great discourse was taking place in academic and activist circles, but it's not really spilling over to everyone who identifies as queer or non-binary or feminist or even ally. Not everyone is vocal. Many are out, closed circles, and others find the available mainstream media available doesn't really engage with them, but often goes over their heads because it's being created by an audience that does not understand the wider issues in and around being queer. And not everyone engages with queer organizations or feminist organizations for meetings and conferences, and that's just not how 90% of Sri Lanka operates. But we believe that we are leaving so many people out of the conversation, and that cannot happen. And when the magazine is about change, we want to pull, our purpose is that we want to pull these large theoretical ideas into a common language and encourage the utilization of these ideas by community members. We believe that rich features journalism is a user-friendly media. I mean, people would rather, read a Cosmo magazine than the Washington Post. because they find stories that engage with them. We are doing this in the online space with vendor magazine. And this kind of space for the audiences we are talking to have not existed. Our mission is to kind of break out of the mainstream model and carve out our own space. It's not about engaging with the mainstream, it's about creating something that you own and makes you part of the community. So we're only 23 days old. We launched on the 1st of November. And we're really proud of what's come out in that short bit of time. We've got diverse content in our first edition that we just published. And I will take you through some of it towards the end of the presentation. So here's also some of our approaches. Number one is intersectionality. Women, queer, trans communities are often left out of the conversation when it comes to social, economic, and political progress in Sri Lanka. These communities face very specific and targeted marginalization rooted in patriarchal norms and politicized chauvinism. I'm talking about in a Sri Lankan and South Asian context, of course. While social media space was born out of and worked well as a proof of concept that people were hungry for a space to share, discuss, and disagree, which is what vendors did. We also felt that the medium fell short in language accessibility. This is why we want to encourage more Sinhala and Tamil creators to contribute to the magazine. We do have some Tamil and Sinhala content, but mainly this is engaged English audiences, and that's an issue that we are still kind of facing, both for Vendor and the Vendor magazine, but we're going to keep at it. The second core area is that we apply a change agent approach. Vendor seeks to make societal change, not only in the discussion of feminist and queer issues, but in taking those discussions out of the policy and academic space and uplifting the diverse experience of the on-ground people as well. So eventually we will be having on-ground content, on-ground events as well. But we want to first be online advocates. So Vendor started with 3 people, but we have 4 people now. Our backgrounds are in marketing, design, in editorial work. So our collective skills put the magazine and the whole initiative of Vendor together. And we've created a contemporary accessible space for people of all backgrounds and experiences to engage in issues that matter. Some media stats I want to share with you because we're so young. The website has been bringing in so much organic kind of hits. It's 23 days, and the stats I've provided you are for the first 15 days only so far, and we're kind of really proud that we've managed to have all of this going. We are proud of the numbers that we've gotten. I mean, we've been boosting content at like $2. We haven't really been, busting our budget on getting in media stats, but they're coming in anyway, which we are really, really proud of. And of course, interestingly, even though we want to carve out our own space, since we launched as a dialogue initiative and graphic design initiative, the graphic design work will also share on a public Instagram page so that people can see the kind of work that we do. And interestingly enough, mainstream media calls us in for our expert opinions now on gender, sexuality, sexuality and queer awareness, on SRH, and on so many different topics which we find quite interesting. So here's a small list of where we've been interviewed on rape culture and so many different topics. And here is kind of a visual look of what we do. So the first logo on your left is Bender, and the Bender magazine logo on your right. You can see that there's a relationship between the two, but they also have their own identities. Bender is a private conversation space, a safe conversation space. And the Bender magazine is a fun, fierce, fearless public space that celebrates great ideas in the features journalism format with great photography, great videography, and great storytelling. It also offers financial rewards for people who submit work and we accept. Here is showcase one. Our 2020 campaign for 16 days of activism, we collected data of 16 different issues that women face in the country, and launched a daily post during the 16 days of activism against violence against women. So how 1 in 4 girls are harassed on a bus every day, how 4 women are raped daily, and also these rape statistics are based on the number of people who actually make entries. In many cases, rape and sexual harassment are not reported to the police for several reasons. So we can only get data and stats out of official complaints. So we don't even have a ministry for women anymore in the country. So that's scary. So this is kind of just a small mapping of 16 issues women face in the country. So like I said, we use graphic design to discuss different topics. 1 week it will be rape culture. 1 week it will be orgasms and vaginas, because we really don't like to talk about vaginas and boobs in Sri Lanka unless it's in a sexual context. We would talk about it from a healthcare point of view. This is one that we did to discuss machismo. Our model has been like weekly content, where we post 5 different pieces of content. And this tends to spark off a conversation, sometimes 100, 150 comments on one post, because there are so many ways that topics like this can be approached and thought about. We do the first spark, and then the conversation takes flight. This is something that was really precious to us. We realized that there's so many issues around victims and survivors of rape, child abuse, sexual assault, and a lot of it has been kept inside. We offered an open call to allow people to write their stories of what happened to them and published them anonymously on our blog. And the stories were horrific, but it also gave so many people in the dialogue groups a bigger perspective of how diverse these issues are. When we say rape, we think one thing, not the entire spectrum of rape. Same thing with child abuse and sexual assault. Now, because of the opportunities to create these stories, people have kind of got a bigger understanding of where all of it comes from. So these are just some of the content pieces we did, and we published the extended stories on our blog. These will now transition into the magazine, of course, slowly. And here's what the kind of a quick look at what the magazine looks like. Like I said, we are 23 days old. We've done some really interesting photography. We ran a competition for content, and we will always run on the model of 15 articles, or 15 pieces of content, whether it's video or audio, or photography or written content. And whatever is available out there in the digital space. I think for all the bad things that technology has done, we are in an age of conversation, and we want to leverage on that idea as Bender Magazine. And it's, of course, as Bender, which we have been doing for a while. And here's just a small look at how diverse the content is. We talk about history. Man Up is such an interesting take on masculinities. There are older women who want to talk about, polyamory. There's art submissions, there's photo essays. There's so much in the 15 pieces of content that we ran, that we chose and ran, that even we are overwhelmed for the first edition. So we are also registered as the Bender Trust, and we are an entirely women-run organization. And we started as 3, like I said, we are now 4. So it's me, Nadine Cruz, Chadili Fernando, and Shane Senevirat. Thank you, everyone.
Thank you, Natalie, for that excellent presentation. Amazing work. And before I open the session, as a moderator, I would like the opportunity to ask each of the participants questions. So how would you like it? Should I address all the questions to the participant directly or one by one? How would the participants prefer? Anyone? I have few questions for each participant. So can I ask all the questions to each participant and move on to the other? Does that sound okay? Okay, so.
Sure.
Okay, so I'll start with Rajendra. Rajendra?
Yes, yeah.
Yeah, we can start the questions.
Yes.
Sorry, the question is, do you involve family or teachers in this program? If so, in what way?
So we use family and teachers directly, but we involve them through parent teachers associations. That is the government led and government formed association in every schools and community. And our young leaders, SRHR champions who are based in the community and from the districts, they organize regular meetings with parents, teachers, associations, and discuss what are the things they are delivering at the schools and the community, and how that will affect their lives, and how the sexuality education they are delivering will empower young people they are working with. That's how we involve parents, not directly family, but the parents and the teachers. And we also supported in developing teachers curriculum and handed over to Center for Educational Human Resource Development in Kathmandu. It's a government-led center led by Ministry of Education, which is responsible for teachers training and developing resources for teachers. So we supported them in this designing and development of teachers curriculum based on sexuality education.
Thank you. Excellent. So can you be a bit more louder? If that would be nice.
Yeah, sorry about this.
Yeah. So now my next question to you is, what was the support system available to these children? Like, and how did you address that in the program? Is there an existing support system, or is how would you describe that?
Yeah, so we do not work on service delivery or providing services, but we work with local CSOs, and in our coalition we have partners from districts and different provinces in Nepal. So being part of the coalition, of being part of the program of the CSOs and the schools and the service providers, especially health post, the school health nurse programs led by our local government. So there are the existing structure. We collaborate with them, bring them together, and let them know that what's happening. And if any young people needs any service or support system, our partner organization is there. Now CBOs and CSOs are there. And also we refer that individuals to service providers like family planning associations or healthcare service providers that comes in our contact. But unfortunately, we do not provide any direct SRHR service to any people.
I think that's fine. So you sort of provide information and this and that, and then you link with another service organization that provides this service. That is the kind of thing. So you have some linkages available where these youth, if they need any services, they can be referred there.
Yeah, we do collaborate with family planning associations.
Okay.
And Nepal government health service providers. So they become part of different discussions and our events we do organize. And they are aware that we are there and we are working with young people and how we empower young people to seek and demand for their service. So if anyone needs such service, then we refer to those service providers.
Thank you. Thank you. So final quick question to you, that what are your suggestions if someone wants to replicate this program in other areas? What should be done? What are your suggestions? Just quick key suggestions.
Well, I think working with young people is not easy, and sexual education in terms of Nepal and Asia Pacific, it's more, it is very challenging and difficult. It links with society. It's linked about a stigma that is around. It's linking prestige. So working only with young people may not work. So the holistic approach is needed for this program. And for the replication, I think we should have a clear strategy how, where, when we want to replicate. And also we need to have a proper management of a fund and sources of fund, how and where we use the budgets and mobilize the funding. And also the commitments from the organization that we want to work, even though there is challenge, even though there is risks on working on this issue, we want to work in this issue and we want to continue the actions we are taking. So that commitment can help on expanding the program and applications. That's all.
Okay.
Thank you.
Thank you. Thank you for that excellent presentation and good work, and all the best for your future endeavors.
Thank you.
So, Natalie, can I have the next set of questions for you?
Yes, of course.
Okay, so excellent work and excellent graphics and excellent presentation. So my first question is, how did you choose the topics for this?
I mean, the number of topics are endless. There is no, it's a case of battling what content to be released this week or this month.
Sure.
Because I mean, the gender and sexuality spectrum has so much to talk about. I mean, I'm battling cancer right now. And I've been both patient and journalist inside public and private healthcare for the last 2 years. And I'm actually publishing my investigation later this week at a festival as a book and a film. But this is something I'm doing privately, not connected to Belder. But there's so much to talk about. Like I said, we fight. What do we talk about today? Are we talking about male stereotypes? Are we talking about specific South Asian male gender stereotypes? You know, and it breaks down, and that's what we meant about intersectionality and reaching out to different opinions that people have.
Good, thank you. So you have in your presentation, you did have one slide on mainstream media, but my question to you is, can you leverage the resources of the mainstream media to reach to a larger public?
We're not interested.
Okay.
We're not interested.
Why not?
I mean, when we are invited to give our opinions, we do. But Bender is about carving out community space for specific communities that have been ignored, that have been insulted, that the mainstream media does not know how to address. And we don't want to work in that space other than to offer opinions when asked for, like I said. Okay. This is about carving a space for ourselves. This is about opinions that are important to us. It's about bringing people together, and that's not what mainstream media does. This is how we are an alternative voice. Yeah.
Okay. So the last question is, when you started this, were there any initial challenges or any roadblocks that you faced, and how did you address them, if there were any?
I mean, for instance, a lot of people asked us about COVID, and I said we've been an entirely digital space, and we've anyway engaged with people on a digital level. We got to talk about more content during the lockdown because everyone was sitting at home and everyone wanted to talk, and so we just kept things going. So challenges are funding, of course. And we are seeking funding to release issue 2, 3, 4, and 5, hopefully in the coming year. We want to be a quarterly magazine. So yeah, let's see.
Okay. Good luck. Congratulations for this excellent work and initiative. Thanks. And good luck for your funding endeavors, and hopefully we get to see more of your work in future. Thank you. Okay, so now, Arthi, can we have the questions for you?
Yes, sure.
Sure. So my first question is, you said there was, in your presentation, you did mention there was a difference in men and girls and boys, the level of knowledge between girls and boys. Did you find any difference in rural and urban youth, or do you reach both kinds of youth, or what is the main population that you reach? Or is there any specific difference that you've observed?
So yes, there is a difference, and primarily what we try to do is to reach out to what we call tier 2 and tier 3 India. Now that tier 2 and tier 3 India can live in big cities or it could live in villages. But how we classify it is that there is certain barriers to access to information. These barriers could be in place in big cities, these barriers could be in place in smaller villages, but in general there is barrier to access to information, mostly because of cultural issues, but also because of lack of access to, let's say, technology, or lack of access to relevant resources. So when we talk about urban and rural youth, there is a difference in the level of awareness on SRHR issues in general, what we call tier 1 and urban youth, they have more access. There are programs and campaigns being run in tier 1 and big cities. They have more access to people with knowledge, and they have better technology access. When we talk about rural youth, they live in a more conservative environment. There are gatekeepers, especially if, like I said, for girls, where they do not even step out of the house to be able to access this information from a community worker. Secondly, they would have less access to mobile phone, digital technology. So when we talk about rural and urban youth, I think the access to information is the biggest challenge. And at the same time, the thirst for knowledge is obviously greater. So when we have rural and tier 2, tier 3 youths engaging with us, we see a lot of questions. There are some genuine and great questions that come from tier 2, tier 3 cities, because the thirst for knowledge is very, very strong without having access to get information. So we engage with tier 2, tier 3 youth particularly, so that that barrier to access is taken away.
Excellent. I wanted to just have a follow-up question. Do you feel that is there a difference? Is there a specific requirement that the gender of the knowledge giver, does that change the uptake of the knowledge? For example, if a male talks to boys or or a female talks to a girl, is there a difference in uptake? Is there a difference in the way they ask questions, or what has been your experience?
So this is the advantage of digital. When we are talking through, it's Love Matters India, people don't know whether they call us admins. They don't know what's the, so when they want to abuse, they think we are male. When they want to ask a question, they think we are females. There is a character called Auntie G. And we flipped the character of Auntie G, because Auntie Gs are supposed to be conservative, traditional, people who judge you. And at Love Matters, there is an Auntie G who gives out all information on sex and relationships. So people aren't very sure of the gender. At the same time, they are talking to Auntie G, where we are kind of really flipping the norms on their head, in terms of a Auntie G kind of a character giving out this information. So I think the digital sort of gap, that the gender neutrality that the digital platforms give helps. But if I talk about offline workshops, there has been a lot of hesitation. For example, I was running this 4-month program where we were giving this Mobicar program that I spoke about. Girls and boys spoke freely. I think it's just the initial hesitation. Once you break through that barrier, people are able to overcome it. So it's more in the initial interactions, but later it has not made huge difference. But yes, the digital helps us break the gender barrier.
So one more question, and do you think this project is sustainable? If so, why? If not, what is the sustainability of this project?
The sustainability of this project remains for a couple of reasons. One, with young people, there's always what's new. What is new thing that you can give to us? What is the more interesting thing that you can do? And that's what technology allows us. There's something new to explore. There is something new to do all the time. And especially that, given that the information that we are giving can be a bit repetitive at times, there are 5 or 6 major fundamentals that you're giving to young people all the time. The technology gives us access, it gives us ways and means to make it interesting and innovative. So that keeps us sustainable. Secondly, what keeps us sustainable is that this information is needed by a new generation every year. Every year someone's turning 18, and every year there is barrier to access this. The barriers have not gone away. A young crowd is sort of graduating every year, but the systems are not changing. There are still barriers to information. So as long as our society completely becomes barrier free, which is a long way to go, the projects are sustainable because they keep young people engaged and they give them information that they need every single year.
Sure. Thank you. That's excellent. We have one question from the audience before I close the session. It's for Love Matters. And what kinds of issues of safety do you encounter while you deliver online? We see a greater shift to deliver online, digital CAC, COVID motivated. What would you recommend to providers who are new to online and digital platforms?
Okay, I think there were two questions in there, but what we recommend to people graduating from traditional to digital is to not copy and paste, which is the tendency a lot that, okay, I have all this information and I just need to put it online. It does not work like that. The information has to be simplified. So what you're saying in a paragraph needs to be said in a bullet point. What you're saying in a bullet point needs to be said in an audiovisual format. And what you are explaining in a workshop format needs to be made, if for the lack of a better word, entertaining and engaging. So what we see, we work with a lot of organizations to help them make this transition. And what we continuously keep telling them is don't cut and paste. Think about what you want to say and simplify it and make it audiovisual. So I think those are the first tips that we would give to organizations that are transitioning. It's just not the same thing. It's a different format, and we need to think about it a little bit when we put things online.
Great. I think that we are nearly reaching our time. So I would like to congratulate all the three speakers. Excellent work, given the challenges you all have faced and the kind of work you have done. And during the past 1.5 years, when there has been a pandemic, the role of digital space has definitely increased. So congratulations to all the speakers, and hope to see your great work in future years. And with this, I would like to end the session from my side. Faisal, would you like to close it, or we can just end it?
Yeah, so no, I just wanted to thanks Dr. Maninder, to you and all the three panelists. It was really wonderful discussion we had. And thanks very much for your time. I just wanted to say thank you on behalf of IPPF, Saro region. And it was really lovely discussion with all of you. Thank you very much. Take care.
Thanks a lot. Good luck. Thank you.